Okay, so we're going to talk about sideline release. This is something that's really important for pregnant women just because we have a lot of tension in the lower part of the abdomen. You have both your round ligaments and your broad ligament that are helping to prevent what's called anterior displacement of the uterus. That means that they are keeping your uterus from falling forward. This is something that is especially important because for women who have very small spaces between the rib cage and their hips, their bellies are going to be a lot more anterior. So this means that these ligaments for them especially is going to be something that's really tight, and it needs special attention paid to it. For every pregnant woman though, typically you're gonna be needing to pay some attention here and make sure that you're giving some love to these ligaments, especially whenever you've been on your feet all day. So this is something that a lot of pregnant women love. It feels really nice and it's something that's really comfortable, and it's a really easy way for us to allow for that release to be put onto those ligaments where they aren't gonna be so taut, and it's done in a passive way where it's as comfortable as it can be instead of doing, friction massage or anything like that, which could be potentially uncomfortable, especially if they're inflamed. So what you'll do is you'll have your partner laying on their side. Their goal is you want to make sure that they are completely lined up. So you want to make sure that head, shoulder, hip, and foot are all in one straight line, so we don't have any torsion in the pelvis. So that's something that's really, really important. We don't want torsion anywhere in the body when we're doing this. So you want to make sure that you have someone supporting you whenever you do this, so we don't have over rotation, which can then cause intrauterine constraint, and then that's completely negating what we're trying to get towards, okay? So this patient's gonna be in one big straight line. She's just gonna hug her arms so that she's comfortable, and then I'm gonna have her scoot. You wanna be as close to the edge as you can without feeling like you're gonna fall off. And this is definitely like being at the OB where you're like, there's no way I can go further. You can go a little bit, okay? So then what we're gonna do is we're gonna have her take this top leg. She's gonna lift it up, bring it forward as far as she can comfortably, and then let it drop, okay? It's really important for you to be holding on to this anterior part of this hip, okay? This is called the ASIS, and this is something that we use for stabilization so that this patient doesn't feel like I'm gonna drop her. So I'm going to let go really quickly, and you can see that she freaks out and holds on with that bottom leg just like she should, because it feels like she's gonna fall, okay? Your goal here, especially whenever there's a big belly, something to take into consideration is you wanna make sure that you have a wide stance whenever you're doing this. So then baby is going to fall basically right in the middle of your wide leg stance, and you're gonna use your belly to support her belly, okay? So what you do is you're standing here, I would be straddling her belly, and then I'm using my hand that's closest to her head to hold on to that ASIS, or the anterior portion of that hip. The next thing that we can bring into it, especially if this patient is having any kind of heartburn or is having reflux issues, is you can take this other hand and you can actually go underneath the rib cage and you can just lift it towards the head. So it's a really, really simple move. You don't want to press too far in. It should just be a really gentle lift. So my left hand is the one that's doing the work. I just have a little lift towards the head. My right hand with these fingers right here is just holding and stabilizing, so no work is being done here, okay? The big thing for this is ideally you want to be able to sit into this stretch for 3 to 5 minutes, okay? So this is something that you want to, get pretty comfortable in. You should be in a pretty athletic stance, bend in your knees so you don't, hurt yourself, and you just sit here and hold. And your, partner is going to tell you whether or not this is comfortable, the rib lift, and if she says it's not, well then let go and then just support here. And your role here in this next 3 to 5 minutes is to either, talk to your partner or talk to your baby. This is your time to connect with your baby. So those are a couple of ideas for there. Make sure that you do both sides. Whether or not you're having tension on both sides, you always want to do both so that you're balanced, and that's sideline release.